Have you ever wondered how aging impacts the male body and how those changes might influence intimacy? Could understanding these transformations be the key to maintaining a satisfying intimate life as we grow older? The answers might surprise you. Join me as we explore a topic that's rarely discussed but deeply important: the changes in the male member that come with age, specifically for men over 60. I'm a doctor and sexologist with many years of experience, and I invite you to reflect and learn about these transformations. This content is designed for those over 50 who want to better understand their bodies and continue enjoying a fulfilling life. Let's dive into this sensitive but essential topic. The male member and aging, a natural transformation. As we age, our bodies go through numerous changes, and the male member is no exception. Some men notice a curvature in their member, a condition known in medicine as Peyronie's disease. This occurs when scar tissue forms inside the penis, causing it to bend in one direction. The change can be sudden or gradual and is more common than many realize. Approximately 1 in 10 men over 50 experience some degree of curvature, and the likelihood increases after 60. Peyronie's disease is often linked to microtrauma in the penile tissue. These microtraumas can occur during everyday or intimate activities and are more likely as the body loses elasticity with age. Over time, as the body repairs these minor injuries, scar tissue builds up, leading to a curvature. This curvature can vary greatly, from a slight deviation to a more pronounced bend, and can impact both the function and aesthetics of the member. Psychological impact: navigating change. The psychological effects of this change are significant. The appearance and function of the body are closely tied to personal identity and self-esteem, particularly in the intimate sphere. For some men, noticing that their member no longer looks or functions as it once did can lead to feelings of embarrassment, anxiety, or a loss of confidence. These emotions may even cause men to question their masculinity or fear that they can no longer satisfy their partners. It is essential to remember that these changes are natural and should not be a source of shame. Aging is a universal process, and intimate life does not have to deteriorate as we grow older. With open communication and a positive mindset, it is entirely possible to maintain a fulfilling intimate life, even as the body undergoes changes. Functional perspective: challenges and opportunities. From a functional perspective, a curved member can influence intimate experiences. For some men, the curvature may cause discomfort or even pain, which could lead them to avoid intimate situations out of fear of pain or embarrassment. This avoidance can, in turn, affect intimacy within the relationship. However, not all men experience pain, and many can continue to enjoy their intimate lives without significant issues. In fact, for some couples, the curvature may introduce new sensations and opportunities to explore different forms of intimacy that were not previously considered. By experimenting with new positions and techniques, couples can often find ways to maintain comfort and pleasure. Age brings with it wisdom and a deeper understanding of one's body and that of one's partner. These insights can enrich intimacy in unexpected ways, turning challenges into opportunities for growth and connection. Medical options and treatments. For men who experience significant pain or difficulties due to curvature, medical treatments are available. These include oral medications. Certain medications may help reduce scar tissue. Injections, treatments to dissolve scar tissue directly in the affected area. Physical therapy, exercises designed to improve flexibility and function. Surgery, reserved for severe cases where intimacy is significantly affected. Surgery can correct the curvature and restore function. It is essential to consult a specialist in sexual health or urology to evaluate the degree of curvature and determine the most appropriate treatment. Preventative measures, such as maintaining a healthy lifestyle, avoiding tobacco and alcohol, and engaging in regular physical exercise can also contribute to overall tissue health and elasticity. Social and emotional implications. The social and psychological perception of health and intimacy plays a significant role in overall well-being. Feeling that the body has changed drastically can lead to feelings of isolation or rejection. This is why it is vital to normalize and talk openly about these topics. Joining support groups or talking to other men who have experienced similar changes can provide reassurance and new perspectives. Breaking the silence surrounding these issues helps reduce anxiety and fosters a sense of community. The role of a supportive partner is also crucial. While the curvature may primarily affect the man, it can influence the dynamics of the relationship as a whole. Open communication and mutual understanding are key to navigating these changes together. In many cases, this stage of life can strengthen emotional bonds and lead to greater intimacy. Adapting to change, a path to fulfillment. Aging is a natural process, and the changes it brings, while sometimes challenging, also offer opportunities for growth and adaptation. A curved member doesn't have to be an insurmountable obstacle. With the right mindset, medical support, and open communication with a partner, it is entirely possible to continue enjoying a fulfilling and satisfying intimate life. If pain or functional issues arise, consulting a professional is essential. Addressing these concerns early can help prevent further complications and ensure a better quality of life. Most importantly, remember that with age comes wisdom, and with wisdom comes the ability to adapt to life's changes, even in the realm of intimacy. Final thoughts: embracing change with confidence. Have you ever considered how understanding and embracing these changes could improve not just your intimate life, but your overall relationship? Could adapting to these transformations bring you closer to your partner? The journey of aging offers opportunities to deepen emotional bonds and rediscover intimacy in new and meaningful ways. If you found this discussion insightful, I encourage you to continue exploring topics of sexuality and health with an open mind. Don't let fear or taboo hold you back from living a full and satisfying life. Share this knowledge with others, and let's break the silence together. Curious about more ways to navigate the changes that come with age? What untapped possibilities could these transformations bring to your life? Stay tuned for our next discussion, where we'll dive deeper into intimacy and health, embracing wisdom and respect every step of the way.